This is Dr. K.D. Tibrewal. I am a consultant physician practicing in Ahmedabad city at my clinic CG Road, and I am attached to the Rajasthan hospital known as Gujarat Research and Medical Institute for last more than 35 years. Well, today we are going to discuss about high blood pressure. It's a very common disease, and probably this terminology is known to practically everybody. The people who are beyond the age of 40 years are vulnerable for high blood pressure. Generally, the most common type of blood pressure which we face is essential hypertension. And there are secondary hypertension also, which has got certain regions where the blood pressure develops, and they may be correctable, non-correctable factors, but these are rarer things. So today we shall be talking about essential high blood pressure. What is blood pressure say? First of all, see, whenever the heart is pumping the blood into the arteries, the blood pressure is being generated against the wall of the arteries, and that is being recorded as a blood pressure. Generally, the above blood pressure, which is generally should be less than 140, and the lower one should be less than 90. That is the normal readings. We are talking about the adult population. If the above blood pressure is more than 140 or the lower blood pressure is more than 90, generally we stamp it high blood pressure. This blood pressure should be recorded at least on 3 occasions in the resting conditions to make sure that the diagnosis of blood pressure is being made. High blood pressure is being made. The people who are above the age of 60, the prevalence of blood pressure is practically in 40 to 60% of individuals. It is such a common disease. And to our surprise, the symptomatology within those patients from the blood pressure is less than 70% of patients are asymptomatic, and only about 20 to 30% of patients are having the symptoms related with the blood pressure. And if they get symptoms, they will seek the advice from the doctors. The point is, if you are asymptomatic and if you just don't get yourself yearly checkup or 6-monthly checkup or regular checkup with the doctors, you can miss out on the high blood pressure, and the complications such as brain hemorrhage, kidney failure, heart attacks, like blindness, sort of diseases which are deadly, can occur because of high blood pressure if it remains uncontrolled. What are the risk factors? Who are at the risk? The people who are at the more above, as the age advances, the blood pressure can become very common. So beyond the age of 40 years, the people are vulnerable for getting the blood pressure. Family history, if the parents or the siblings are having blood pressures, those people are 2 to 3 times more vulnerable to get blood pressure as compared to the people who doesn't have the family history. If you are having excess of salt intake, I mean, you are more vulnerable for getting the blood pressure. If you have got less of exercise, if you have got sedentary lifestyle, again, you are more vulnerable to get the blood pressure. And if you are vulnerable for mental stress, you are more vulnerable for getting the blood pressure. If you are a diabetic patient, again, you are more vulnerable for blood pressure. So blood pressure is a simple disease, simple to diagnose, but if it remains untreated, it can lead to deadly complications, which I talked about. So it is very important to get yourself checked up yearly basis or 6-monthly basis after certain age. And if you are diagnosed with the blood pressure, you have to take the medicine on regular basis as per your doctor's advice. And generally it is lifelong, except that you are grossly overweight and you are getting yourself into weight reduction mode of say 25 to 30% weight reduction can, if you are getting that sort of weight reduction, probably you can achieve normotensive state once again. But generally, the early diagnosis and accurate diagnosis is really very important in the cases of blood pressure. And the regular treatment to be taken lifelong basis mostly is the key factor which has to be borne in mind by everybody. Blood pressure medicines are generally given lifelong, and their medicines has got minimal side effects. Though certain medicines has got side effects, but these can be discussed with your doctor, and the doctor generally tell you about what are the side effects of blood pressure, and you have to keep those things in mind. So whenever you start your blood pressure medicines, you should know what are the side effects of the medicines which can happen. And if you are keeping those things in the mind, probably you can discuss whenever those side effects comes into the picture. You can discuss out with the doctors and probably you can get them changed. But to get rid of blood pressure, like if you've got some side effect and if you just stop the medicine and you don't change the medicine, you don't discuss with the doctor, probably that is very dangerous. To prevent the blood pressure, you should have regular exercises. You should have healthy diet. You should not smoke or eat tobacco. You should have regular blood pressure monitoring. You should have regular management of stress, and you should adhere to the medicine. That is how you can take care of this high blood pressure, and you can prevent the complications of hypertension to occur. And this regular exercise and physical activity can help you immensely, not only to control the blood pressure, to control the diabetes also, to control the cholesterol also, to control the stress also. And these stress, cholesterol, high blood pressure, diabetes are the deadly combination which can lead to the early heart attacks, early strokes, and kidney problems. So whosoever is having the multiple problems of this nature, high blood pressure, diabetes, and dyslipidemia or high cholesterol, they should be very cautious about taking the regular medicines and get them regularly checked up with the doctors and getting all the 3 factors controlled and keep the stress as low as possible. You should have healthy diet in cases of hypertension, what we call DASH diet, or it is also called Mediterranean diet, where you are eating less of the saturated fats and eating a lot of potassium, plenty of potassium, which are there in this fresh fruits, and limiting the amount of sodium in the diet and avoiding the alcohol consumption. So you should take care of your diet, you should take care of your stress, you should take care of your exercises, you should have healthy living and healthy thinking. You should not have negative thoughts, so you can reduce your stress. And tobacco in any form is very dangerous and should not be there. Otherwise, it becomes another risk factors other than all these 3, and which can add on to the already having the problem of getting into this sort of complications which I am talking about. These are the few points which I wanted to highlight about the high blood pressure. I hope this was interesting for you. Thank you.